The University of North Carolina, Chapel Hill is the first public institution of education in the country, and the School of Medicine is really grounded in that background. The Department of OBGYN has long been recognized as a leader in education in OBGYN. UNC Maternal-Fetal Medicine has been on the forefront on information dissemination throughout the state and evidence-based practices. Examples of that is the discovery and dissemination of the use of 17-hydroxyprogesterone for the prevention of preterm birth. Dr. Nancy Cheshire, who's one of our senior faculty members and currently the editor of the Green Journal, was part of the team that designed and implemented the original, what's called the MOMS trial, which is held up really as the clinical trial that demonstrated the benefit of operating on a fetus in utero.
We have experts in many different aspects of maternal-fetal medicine care, ranging from reproductive epidemiology, fetal intervention, clinical trials, prenatal diagnosis, so that our fellows are exposed to any possible thing that they might encounter in their future career.
We have a diversity of faculty, both in patient care skills as well as in research skills that can provide a different approach and a different outlook to the fellows in training. I think we certainly have the breadth and depth of skills needed to teach the fellows to care for the complex maternal-fetal medicine patients.
We have so many experts here doing research in so many different areas and have goals to reduce the rate of preterm birth in North Carolina and improve our ability to make a prenatal diagnosis, reduce maternal mortality and morbidity, and there are a lot of initiatives going on to achieve all of those goals that have grassroots starting at UNC.
Maternal-fetal medicine at UNC has been a leader in education, but also in research. We have enjoyed being part of the Maternal-Fetal Medicine Network, UNITS Network, which is a collaborative group of researchers across the country, and many important contributions have come from that work and other clinical trials and basic science work that we've done here at UNC.
The division here, and really UNC as an institution, is committed to expertise and excellence in care in global health and in global health research. And there's not a lot of places that can say that. And we have a nice combination of being able to take care of our own patients here using state-of-the-art and evidence-based practice, but we also have the ability to take care of patients in Malawi. We have a very robust telemedicine service, which I run here, and we're able to reach out to patients in rural areas in North Carolina, and we're extending that into West Virginia now. So the university and the division really have a commitment to a mission of providing care to underserved areas.
The Center for Maternal and Infant Health was founded about 15 years ago as a partnership between the departments of OBGYN and Pediatrics here at UNC. The center was originally founded to provide comprehensive care coordination for high-risk pregnant women and their infants through about 2 years of age. Whether it's from our coordination at the bedside with our case managers and clinicians, to the work that we do in brainstorming around the table about what else we could do in North Carolina, I think that our great communication is something that makes us very strong.
UNC feels like a family. The providers I work with are extremely caring. They care about their patients not just as a case-on-case basis, but also individuals, moms and parents, and they see their patients that we deal with as other individuals who are suffering and they can understand.
We have an amazing group of providers that works together in a collegial environment to provide the best care to our patients.
The future of the work of maternal-fetal medicine here at UNC is vast, really. It's totally going to be grounded in our commitment to the mission of furthering the health and well-being of women and infants in North Carolina. We have the foundation for great clinical care in the context of an environment that's very conducive to learning. We can extend our influence in really important ways by training fellows, residents, and students in the art of maternal-fetal medicine.